The American Cancer Society recently reported that more Americans are surviving cancer, but the disease is striking young and middle-aged adults and women more frequently. To learn more, we welcome Dr. Rick Bold, Site Director for Mayo Clinic's Comprehensive Cancer Center here in Arizona. Doctor, good to have you here. Thanks for joining us.
Thank you. Thank you for inviting me.
You betcha. Cancer rates, women 50 to 64, they're increasing. Why?
That's a tough question. And it really depends on the cancer because there are different causes for each cancer. For example, lung cancer, we know the cause. Smoking is really the primary cause for development of lung cancer. And with all the efforts around smoking cessation, we saw that decrease. But we're seeing other cancers increase, and we don't have that same causal relationship. We're seeing uterine cancer, breast cancer, colon cancer. We really can't pinpoint it to one specific thing.
What about better testing and earlier testing?
Those have always been our keys to really curing more people and decreasing the burden of cancer. And that brings up an interesting point. During COVID, we saw decreases in our screening activities. We saw fewer women getting Pap smears. We saw fewer people getting colonoscopy. So maybe this is part of it, but it's probably not the only contributing factor.
Yeah, it would suggest that in previous years, these folks really did have cancer but never knew it, and it developed later on in life. Perhaps that's what's going on.
Perhaps. Sometimes we find things like, for example, colon cancer. If we find a polyp, we remove it during colonoscopy, and it never develops into cancer.
Right.
So when people are getting their colonoscopy, not only is it screening, but it's preventing subsequent cancer.
So cancer kind of has always been considered a disease of aging. Is that changing?
That's changing. There are a variety of things that are contributing to cancer that we really hadn't clearly identified, but now see more clearly. For example, human papillomavirus, HPV, contributes to head and neck cancer, cervical cancer, anal cancer. And with the incidence of the virus, we're seeing an increasing incidence of those cancers.
Wow. African American, Native American women cancer patients dying at 2 to 3 times higher rates? What's that all about?
A great question. Some of it is screening. We know that there are disparities in terms of utility of those screening maneuvers. Mammograms for breast cancer, colonoscopy for colon cancer. And some of these populations don't have access or don't pursue those. But it's not just that. There's a lot of contributing things. Environment, food, obesity, activity, all of these things really add together.
When we say 2 to 3 times higher rate, is it a 2 to 3 times higher rate than in the past? Obviously over white patients, but over the past, or is it increasing there as well? What are the numbers showing there?
So it's increasing as well as higher than white patients. So it's both that's really contributing to that burden of cancer deaths.
What about, and judging, we're doing some research on this, it sounds like, yes, cancer in younger women, middle-aged women on the increase. Older men, not so much.
Yeah, part of that's the smoking cessation efforts that we're seeing. Part of it is things like screening. Many men routinely now get PSA checked for prostate cancer. So earlier detection is really that way to do. That penetration of those screening activities, the education and awareness that a screening can actually save my life, hasn't really gone in deeply into the younger population.
And yet, again, 6 of the 10 most common cancers are on the rise. Gotta think the testing paradigm there is at play.
It's a great question, and we're really looking at that. So utilizing colonoscopy for colon cancer. A lot of these things are, let's call them one-offs. Pap smear for cervical cancer. We're really trying to develop blood tests that cover a spectrum of cancer so you can actually get tested with one sample and actually be screened for 10 cancers simultaneously.
Those blood tests, that's interesting. Those blood tests, do they look at genomes, DNA? How are blood tests now being used in cancer detection?
There's a variety of ways. There's got to be 50 companies trying to find the best blood tests. Some of them use DNA that's shed by a cancer cell that's detectable in the bloodstream. Some of them are using proteins. They're all trying to find the magic way to see that incipient cancer cell in a body manifest in a blood test.
Now we're talking about cancer rates, again, rising in women 50 to 64. The rates are rising. What about survival rates? And what about, just the years of survival? What about treatment?
That's a really deep, complex question.
Yeah.
So in some circumstances, survival rates are actually improving. So we're seeing better survival for lung cancer, for breast cancer, for prostate cancer, colon cancer. But with all of that, some of it is screening, some of it's treatment. We're getting a new set of tools in our toolbox to treat cancer. We're using the immune system to treat cancer. We're doing specialized radiation. We're doing surgery that really wasn't always possible. So we're both increasing the tools to catch cancer early and then better treat it to increase quality and length of life.
And that is working.
Yes.
That is work. So that's something encouraging there.
Absolutely.
Even if it's discouraging that so many people are now at the increasing rates as far as cancer diagnoses. Okay, what do we take from these numbers? What do we take from all these facts and figures?
It's a good question, and I think a really balanced approach. Yes, the overall incidence is increasing. We're going to see 2 million Americans diagnosed with cancer this year, over 40,000 here in Arizona. So there are more people with cancer. But with screening and early detection, we're achieving more cures. We're developing better treatments so that people can live longer.
And with every cure, with every treatment, there's research involved there too, isn't it? It's more knowledge.
Absolutely. You asked that question about those earlier diagnoses, and I was saying we don't understand the causes. That's why we're doing research. Once we know the cause, then we can intersect and change that causal relationship and prevent cancer even before it begins.
Dr. Rick Bold, again, Mayo Clinic Comprehensive Cancer Center. Interesting stuff. Good to have you here. Thanks for joining us.
Thank you for having me.